Hello, everyone, and welcome to today's Adult AML Chapter event brought to you by the HealthTree Community for AML program. My name is Katie Braswell, and I'm the HealthTree for AML Director. I'm so grateful to have each of you here for our meeting today and for your support in building this Adult AML community. I'd like to let you know that today's session will be recorded, and the recording, along with the slides and any resources we discussed today, will be sent via email to all registrants within 48 hours after the event has concluded. I'll start with a brief Zoom meeting tutorial for those of you who are new to using the platform. We would love for you all to turn on and keep your cameras on if you feel comfortable. Doing so helps us to create a stronger sense of community. You can see on the slide how to turn on your camera. At the bottom of your screen, you should see the microphone and camera buttons. You can click the video icon that says Start Video in order to turn your camera on. With that being said, if you're not comfortable being recorded, you're not required to keep your camera on. Your microphone should currently be off and will be kept off by our team throughout the presentation. During the group discussion, you're welcome to unmute yourself once you're called upon. If you have any questions or comments for us or for our speaker throughout her presentation, please click the chat icon and type them in the chat box. If you're using a mobile device or tablet, click the three-dot icon that says More and then Chat, and then in order to access the chat box. And lastly, if you would prefer to verbally ask a question or make a comment directly to our speaker during the discussion time at the end, we encourage you to do so. If you're using a laptop or desktop, click Reactions near the bottom of your screen and then click Raise Hand. If you're using a mobile device or tablet, you can click the three horizontal dots that say More and then click the Raise Hand button. And now let's get started with today's event. First, I'd like to thank our sponsors, without whom this event would not be possible, Servier and Astellas Pharma. The topic of our event today is titled Infection Prevention for AML Patients. Here's the agenda for today. I will introduce our speaker, Sami Salvatora, and she will spend the next 30 minutes or so giving us her presentation. After the presentation, we'll open it up for your questions and comments. So let me take a second to introduce our speaker, Sami Salvatora. Sami is a physician assistant in the leukemia department at MD Anderson Cancer Center. Her role as a PA focuses on diagnosing and treating acute and chronic leukemias and developing treatment plans for patients. Sami is a founding member and leader in the Leukemia Patient Education Program, or LEAP, at MD Anderson, which is a program designed for patients with acute leukemias. She is also active in training other physician assistants and medical oncology fellows. We are really honored to have you here today, Sami, and we can't wait to learn from you. So I will let you go ahead and take it away.
Thank you, Katie. All right. Well, hello, everyone. Like Katie said, my name is Sami Salvatora. I'm a physician assistant at MD Anderson, and I've been there for about 7 years now. I will be talking to you about infection prevention in our acute myeloid leukemia patients. So objectives for today, I always like to start with explaining why our patients with AML are at risk for infection. I think it's important to understand the background there. We'll then talk about how we do detect, or how do we know there is an infection, what to do if you do think you do have an infection, and of course, most importantly, what can we do to prevent these infections from occurring? So why are patients with AML at high risk for infection, and why do we see this happen so commonly? There's three main reasons. The first being that low white blood cell count, followed by the chemotherapy, and mucositis or infections in the GI system are commonly seen. So these all basically go hand in hand with the diagnosis of acute myeloid leukemia. So a lot of the times at diagnosis with AML, we do see a very low white blood cell count before the disease is even treated. And the white blood cells are very important because one of the types of white blood cells that help to fight off infection are our neutrophils. And when our neutrophils are very low, the body is unable to detect that there is some foreign body or some foreign bacteria, virus, fungus that is attacking, and we aren't able to trigger that immune response. So therefore, due to that very low white blood cell count, the body is then at a high risk for infection. And if the white blood cell count happens to be very high upon diagnosis, just these white blood cells aren't functioning properly. We don't normally have that really good neutrophil count to be able to fight off those infections. Second, we do have the chemotherapy. So once our patients start to receive chemotherapy, the white blood cell count does actually start to drop because that is part of the treatment. And when that white blood cell count drops, again, the body is exposed to possible pathogens. Also, these chemotherapies are really targeting our really rapidly producing cells throughout our body. So most commonly, we see the cells of our skin get very weak, and then the lining of our GI tract. So everything from the stomach or the mouth all the way through the anus. So this leads to then that mucositis or any little injury to this protective barrier that we have can get infected. So sometimes these normal bacteria that are found in our gut can actually cause an infection because they do get into our bloodstream. So that is why when we do have this mucositis or these mouth sores, we can also have an infection because those do get inflamed, and it can be another source that allows the body to be susceptible to infection. So it's just kind of breaking down of one of our barriers there. There can also be sometimes these micro, tiny tears in the intestine that can then lead to one of those normal bacteria or some type of foreign bacteria to just get into the bloodstream and also cause problems. So we'll further talk about other types of infections that we can see in our patients that are really receiving that chemotherapy. So typically the first sign of infection we see in our patients with AML with a very, very low white blood cell count is fever. And that is because the body doesn't have that immune system to fight off. So this inflammatory reaction is creating that fever, and that is usually the very first sign of infection that we do see in our patients with especially neutropenia. So we characterize fever as anything 100.4 degrees Fahrenheit or higher, or 38 degrees Celsius. Typically, when our patients develop fever, they are neutropenic, and that means that their white cell count is very low, and those neutrophils or those good white cells are less than 1. And this is a medical emergency because the body does not have the ability to recognize and fight off infection. So like I said, temperature is 38 degrees Celsius or 100.4 or higher. And if the patient happens to know that they are in the middle of their chemotherapy and their neutrophils are probably less than 1, this is a sign of a medical emergency because this neutropenic fever can progress very quickly, and that's really our first sign of infection. So when in doubt, we assume that these fevers in our AML patients are caused by a bacteria, a fungus, a virus, unless proven otherwise. So our recommendation there is to stop that fever from progressing into an infection. So actually report to the emergency room immediately because we would want us to start IV antibiotics as soon as possible. So the goal for the guidelines there is basically within 90 minutes. So I always tell all of my patients, when you have a fever, I don't want you to think, should I call Sami and see if I should report to the emergency room? I want you to be in the car and tell me, hey, I'm on my way to the emergency room. And I'll say, great, good job. So we want to do everything we can to keep you healthy. Once we get to the emergency room, they will be doing lots of testing to see if there is an active infection. So that is testing the blood to see if there is any type of bacterial growth, as well as checking the lungs for infection, and depending on if there's any additional symptoms, to do further testing as well. So the big reason we are always concerned about neutropenia and neutropenic fever is because this can be the first sign of a bacteremia or a blood infection. So bacteremia is basically when we see that there is a bacteria in the bloodstream. And usually the first sign of this is a fever. However, we can see additional symptoms. So sometimes if patients do not develop fever, they'll just not be feeling like themselves and may report that they just have the chills and they just cannot actually get warm. Along with that, we can see a very low blood pressure. So sometimes like systolic, if it's less than 100. I do say if this is abnormal. I know some patients have kind of a steady 100 systolic, but if the blood pressure is quite low, or if they're having like a rapid heart rate. Other symptoms we can see, along with chills, we can see other signs of infection. So a new onset of a cough, there could be a rash, and also there could be nothing besides the fever, unfortunately. So to make that diagnosis of bacteremia, those blood cultures will be drawn. So they do actually draw the blood and we'll check to see if there's any bacterial growth. Sometimes patients will have a central line or a PICC line, which is a line that actually goes directly into the central line to your heart. And these are great, but they can also occasionally get infected. So they will test from the PICC line and then also the peripheral to see where is this infection coming from? And then can we treat it? What would be the best way to do it? So usually when patients come into the emergency room and we are concerned that they might have a bacteremia, they have that low neutrophil count, antibiotics are started immediately along with antifungal and antiviral therapy to help treat that infection until we really know what is the cause. So how can we prevent these infections? Most commonly, the best thing we can do is good hand hygiene. So wash your hands frequently or use hand sanitizer prior to eating, and just kind of as frequently as you can think of. So I know when we're in the hospital, there's hand sanitizer machines all over. Feel free to use those as frequently as possible, or whenever you get back in from being at the hospital or at a visit somewhere else, as well as just kind of, as we've started to do with COVID, it's kind of helped out wiping down carts and things prior to using to help reduce that spread of any type of infection, anything that might be shared equipment with others. Next is wearing masks. So mask use, especially when you're at the doctor's office or at the hospital, as well as it is helpful to wear it if you are traveling or if you are going to the grocery stores, if you are out in public. I think mask wearing is very important, especially when you are in a confined space as well, to help prevent that spread of any type of like respiratory infections. So I think one good thing about COVID is people are a little more comfortable wearing masks around in public, and I think this can really help prevent the spread of illness. The other big thing, avoid others who are actively ill. If you know someone who's had a recent exposure, of course, to COVID, or maybe is recovering from flu or a respiratory infection, it would probably be best if you can to avoid those or avoid seeing those who are very sick. This also kind of goes for, I know a lot of people have grandkids that they want to see, but I would advise avoiding them, unfortunately, if they are having one of those colds that occurs every other week, or at least wear a mask and hand hygiene around them. So helping to protect our GI system, we do encourage a well-balanced diet. The only thing I really ask my patients to avoid is like raw or undercooked meats and raw fish, raw oysters, anything that really is at a high risk for getting a foodborne illness, because the body and the GI system is really a lot more susceptible for that bacterial infection or a virus that could be found. My recommendation for fruits and vegetables, I am a believer that fresh fruits and vegetables are fine and safe for my patients if they are washed very well at home by yourself. I would not recommend eating off of a salad bar, or probably would avoid just eating out at like somewhere that does serve fresh fruits and vegetables, because you don't know if those people how they do prepare their fruits and vegetables, have they been washed, who is touching that. So I would say if you do want fresh fruits and vegetables, just make sure you are washing it yourself and being careful there. And then other recommendations, I just encourage well-balanced diet for my patients, and just be careful with where you are eating. Probably would not recommend like food trucks, but still be careful. And then other recommendations, which sometimes is forgotten, is to avoid shaving or avoid sharp razors. These can cause these little micro tears and nicks in the skin, which can lead to an infection. If that would happen if the immune system is well, we normally don't see a skin infection or bloodstream infection from shaving. However, with the weakened immune system, there could be bacteria on those razors. So we recommend using like an electric shaver instead to avoid any type of cuts and nicks. So just protecting the body from possible exposures. So there are many different types of infections we can see. One most common is the cellulitis, or some type of an infection of the skin. As I was saying with razors, those razors can cause a nick or tear in the skin, and they might look fine at first, but you can start to see the area around where a nick or cut might have been. It gets red, it's very swollen, inflamed, there might be some type of discharge, and there will be like a redness and warmth that starts to swell actually around that injury. So that is very concerning. Other things that can cause like a cellulitis or skin infection can be seen, unfortunately, animal bites, or even like an insect bite, like mosquitoes, just from that constant scratching. So my recommendations, if you ever do have any type of cut, nick, or cut yourself cutting something or pulling, I've had patients bleeding and cut themselves. Of course, wash it immediately with antiseptic and put some antiseptic on and try to keep that covered. But most importantly, go and see your provider, because likely they would want to put you on some type of additional antibiotic coverage and to really evaluate what was the cause of that. Along with any type of animal bite, or I've seen scratches from a cat. So animals can have a lot of different bacteria, and even a healthy human could be susceptible for an infection from these types of injuries. So definitely go and see your provider if you can immediately. Otherwise, if this is something that would happen on a Friday, I wouldn't wait until Monday to be seen. I would probably recommend going to the emergency room immediately. With like insect bites and scratching, of course, I would try to avoid that or keep them covered, do something to avoid any type of injury there. But these are just common things that we can see that lead to infections. So being able to detect this is something that could become infected, and what might my provider want to do, and how should I go about addressing that? So always contact the primary team. Other types of infections, we'll commonly see upper respiratory infections or pneumonia, so a little cough, congestion, runny nose. Some of these unfortunately cannot be prevented. We do our best, but I think it's very important to be aware that these things could be a sign of infection that do need treatment. Others, another one, urinary tract infections. These can present very differently. Sometimes we do see fever in our patients with urinary tract infections or UTIs. There can be burning with urination. You can see discharge or urinary frequency. Those are more common, but occasionally in our older population, we can see signs of confusion or disorientation from these urinary tract infections. So that is something in addition to just look out for. And it's okay to be comfortable to talk to your provider about these types of symptoms. Going along with foodborne illness, we can get inflammation in the colon, we can get food poisoning just like anyone else. And the list really goes on and on. So I think the take home here is have that open conversation with your provider and be aware that these infections can happen. So most importantly, what should I do if I suspect there is an infection? For me, I tell my patients right away, visit one, what's the best way to reach me? So I encourage every patient to have that conversation with their provider. What should I do if I develop fever or I'm not feeling well? Open that conversation. With that question, I'm sure they might say, you need to go to the emergency room. But you can also ask, what is the best way to contact you if maybe you have a non-urgent question? Figure out what is the best way. Do they have an after hours line? Is there a on-call pager? Is there an email address? Is there a MyChart? What is the best way? And do you feel comfortable contacting them in that form? I would say most times our providers would prefer to be contacted than not hear anything at all. So indications on just in general when to go to the emergency room. Number one is fever. Number two is, of course, if there's any type of infection in the skin, if there's a cut, if there's an injury. If we see any changes in mental status, that's another reason to go directly to the emergency room. In general, these are all things that do happen very quickly. So these acute onset of symptoms can happen overnight, and unfortunately, they may happen at 2 or 3 a.m. And the only option there is to go to the emergency room. But I just drive this home because, I know patients do the best that they can to prevent infection. And unfortunately, with this disease, sometimes we can't prevent everything. So I just encourage patients not to underreact. And in this case, there's no overreacting in this scenario. So we do things to help prevent these infections. What we do here at MD Anderson is we usually put our patients on 3 types of what we call prophylactic antimicrobials. The first one is an antiviral medication. So this helps to really prevent against any type of viruses, most commonly like HSV or something that might cause the herpes, prevention of the herpes virus or recurrent like of a shingles outbreak. These medications may be called Valtrex or valacyclovir. The other one is acyclovir. Antibiotics, we use antibiotics to help prevent mainly any type of lung infection, but it can also help prevent some skin infections and upper respiratory infections. So most common antibiotics are Levaquin, levofloxacin, or Cipro or ciprofloxacin, but there are others, of course, in case there is an allergies. So there is quite a lengthy list there. There also are antifungal medications. So these help prevent against fungal infections. Most common fungal infections we'll see are pneumonia is actually caused by a fungal infection, and the antifungals commonly used are voriconazole or Vfend, noxaphil or posaconazole. We also have Cresemba, which is new, and then one of the oldest ones is fluconazole. These antifungals also can help with any type of like mouth infection. Sometimes due to the low immune system, patients can develop thrush or kind of like a white coating on the tongue. So these antifungals seem to help prevent that. So although we put patients on these antibiotics, antivirals, antifungal medications, and they do have very good broad coverage to help prevent infection, sometimes there may be some little bacteria, virus, or fungus that these medicines don't cover, cannot prevent a larger infection from happening. So these can certainly help prevent infection along with all of the normal precautions of hand washing, washing fruits and vegetables, monitoring for fever, but it is unfortunately not a perfect formula. So another interesting conversation is, can I get vaccines? There are quite a few safe vaccines to get. Ones that I normally recommend for my patients to get every year is the flu vaccine. And then they are recommending the COVID-19 vaccines and those updated formulations. The one take home with vaccines, I do recommend patients discussing with their provider when to receive a vaccine, because it is most beneficial to receive these vaccines when the blood counts are at their best. So that way the white blood cell count can actually create memory of this exposure and can help to prevent that infection. So I do recommend discussing vaccinations with your provider so they can help guide you on when to get the vaccine, and they may provide it in the office. Usually the flu vaccine we do give, there are recommendations. We do want the neutrophils ideally over 1, but at least over 500 or 0.5. The platelet count, usually with the injection in the muscle, the platelets need to be above 50 or 50,000. So those are the standard guidelines there for blood counts. And then after a little more research, most of the vaccines that we do have now are not live vaccines. So most of the vaccines are safe for patients to receive. The one that is a live vaccine still is the intranasal flu vaccine. So I do not recommend the intranasal influenza. So unfortunately, it's the injection there. So how can family and friends help? I think it's important for family and friends to be aware of the patient's diagnosis, the nature of the disease, and therefore I think it's very easy for family and friends to understand and be able to respect their significant others or friends' disease. And I recommend, if you are around a lot of family and friends and in an enclosed environment, wear a mask, encourage them, good hand hygiene, try to avoid kind of kissing and hugging too much contact, and then avoid the patient when they are actively ill. So if you do know that you've recently been around someone who has been sick, or if you start to feel under the weather at all, I would recommend just letting them know you think it might be best if you stay away. There are, of course, some circumstances that people live in the same household and we can't always keep our distance. And that's when the good hand hygiene comes in, washing and wiping down counters frequently, and wearing masks to avoid that spread of that possible infection. And that is what I have, and I am happy to take any questions.
Thank you so much, Sami. That was
Sure.
excellent. A great overview of a really, really important topic. So thank you for that. Let me go ahead and share my screen now, and we
Okay.
can move into our discussion portion. We have a good amount of time to take questions. We'd love for this to be interactive. Whether you have a question, a comment, you'd like to share even your own personal experience, I think this is a great time to do that. We can all learn from each other. So if you've had an infection that you've been through, if you've done certain things to reduce your risk, talk to us about how it's going. This is a great time to share. So a thank you already from Juliet, saying that was comprehensive and reassuring. It's good to hear from you, Juliet. I'm glad you're here today and that it was useful. So whether you want to type in the chat or use the reactions button, I see a raised hand from Ted. Hello, Ted. It's good to see
Hi,
you.
thank you. You can hear me okay, Dr. Salvatora?
Yes, I can.
Great. My name is Ted Peterson. I'm the father of a 2020 leukemia, a daughter diagnosed with leukemia at age 29. She's now 32. After a second stem cell transplant at Johns Hopkins, she's now 18 months as of yesterday, the 15th. Still in remission and in seemingly good health. Her hair is back and she's back among the living. But I want to ask you, I get fever, bleeding, bruising for any sort of relapse, but what sort of infections should one look out for? I heard a nasty story about somebody getting a cut on their leg after 2 or 3 years in remission, and they got sick and didn't make it. So my question to you is what if someone's on their way to some recovery and then a dog scratches them? I mean, are there things you should look out for without relapsing that might be impactful to infection?
It's a hard one. Unfortunately, I think skin infections, getting a cut is, I think, something that's commonly overlooked because a lot of us are just used to getting a cut and it might hurt a little and it recovers on its own. So with that, some type of like skin infection, or if you do have an injury or a cut or a bite from a dog, those types of things, I would still say, and especially in her situation, I would just go to the emergency room and report that, you know, she has a history of acute myeloid leukemia, has received multiple stem cell transplants. I don't know if she's off of all of the immunosuppressant medications, but those are reasons for a visit, unfortunately, to the emergency room. I think that's the really hard thing with our AML population. There are just so many times where, unfortunately, we need to have that patient evaluated immediately, and sometimes the emergency room is the only way to go. So I would say being seen immediately, starting IV antibiotics, and if it takes a while to get to the emergency room, if you're out in the country, if you do have antibiotic ointment on you, start to clean it with, you know, soap and water if you can, or alcohol, which I know would burn, and put some antibiotic ointment on it and try to prevent that infection from spreading rapidly, because those are also ways that bacteria can enter into the bloodstream. So, but
Thank you.
yeah, you're welcome. I hope that answered your question. I know
Well,
it's
it
hard
did.
to really detect relapse sometimes, especially in our patients who've had multiple transplants, but close follow-up with the local oncologist, with the stem cell doctor is very important.
Right. Thank you.
A question from Megan here, asking about preventative prophylactic care. So instead of waiting for an active infection, are we using antibiotics preventatively at all?
Yes. So all of my patients, we start them on an antiviral and an antibacterial when they do start treatment. even if they may not be neutropenic, or if we don't know how they may tolerate the first cycle of the therapy. This is just to help prevent infection. And then we normally also do just preventatively add that antifungal, because we know when the neutrophils are very low for an extended period of time, the body's at an increased risk for infection, especially with fungal infections. So we typically start them on these prophylactic medications. That's our practice here. I know other institutions so do things a little differently. I know providers as well that will start and stop antibiotics, antivirals, and antifungals, depending on a patient's blood count and their response to treatment as well. So it is something that is also tailored to the patient.
I'm wondering if there's any role for probiotics. Can those be potentially dangerous?
I don't normally recommend them. I think we don't want any active bacteria that's really foreign to the gut. My rule of thumb is if they have been doing something for years, we don't need to change it, but we don't need to start something new to try to improve it if we've never done it before. And that kind of goes along with kind of going off on a different direction, but pets as well. Sometimes patients are concerned, oh, I have a dog, I could get an infection from this. Well, if you're constantly exposed from that same animal, the likelihood of you developing that new infection from that, I think, is low. But it's like when you decide, oh, I'm going to get a new puppy today, and I've never had a dog. So there's some things that, just you can talk to your provider. We are happy to answer any questions.
Sure. A tip from Patricia saying you might want to mention avoiding cutting cuticles. Instead of doing that, it's probably better just to push them back. I guess that's getting at avoiding risk of cuts potentially.
Correct. Yes, I do agree with that. Also, one of those things, best to probably avoid going to the nail salons, because you don't know how clean that material is. So again, avoid anything where you could get a cut or an infection.
Yeah, great. I see Julia S. has raised her hand. So if you'd like to come off mute now.
Hello. Hi.
Hello.
My question isn't exactly pertaining to infection, but you mentioned mucositis is a side effect of chemo. I'm on Onureg maintenance chemo for AML, and I recently had extremely low vitamin B12, which was contributing tremendously to my fatigue level. Was pretty bad. So my question is, can mucositis lead to problems with absorption of nutrients like vitamin B12?
Technically, it could if it was really in the gut. A lot of the absorption is not orally, but we can have mucositis throughout the entire intestinal tract. So therefore, yes, since B12 is typically absorbed through the gut, then it could lead to low counts. That being said, also taking I'm not a huge supporter of take a ton of vitamins and minerals, because our patients are on a ton of medications. I don't need to upset the gut anymore, but like a B vitamin or a B complex would be fine to take. Might not be absorbed at 100%, but might help a little. Or if your doctor wants to do like B12 injections, that would be
I did those, and it was effective. It brought it back up.
Good.
But it's kind of a mystery why that happened. So I'm trying to figure out if it's the effect of the chemo or what. I don't know. I've never had that before. So
yeah.
Okay, well, thank you.
You're welcome.
Okay, let's go back to the chat. Mary is asking for suggestions on how to start a conversation with family and friends about not seeing them if they might be sick. How do we do this without making them feel bad or awkward?
That is a hard one. I know, I mean, from kind of personal, I've known friends and family who have had a cancer diagnosis, and they'll actually share their story through email. So it's kind of like a mass blinded email to a bunch of friends and family to keep them updated, to one, let them know what is going on in their journey with this. And then within that, you can give the recommendations like from their provider. You know, it was recommended to avoid those who are ill. So that's one way to do things a little mildly. I also have a lot of patients that if they have had to try to have those conversations in person with family, with friends, and they don't seem to understand the severity of things, we'll put them on speakerphone during the doctor's visit or on FaceTime so they can actually hear from the provider themselves. I think a lot of it comes with really educating family and friends that, you know, so-and-so has been diagnosed with acute myeloid leukemia. They are receiving very strong chemotherapy and they're at a very high risk of infection. And our provider recommends to talk to family and friends. And if you are sick, please let us know. We'll be really grateful and appreciative for you to share that so we can try to prevent any infection. So I think maybe encouraging them to not feel bad to maybe like cancel plans or something last minute because they are sick. It is a difficult one. I think sharing information though and just keeping everyone educated can be very helpful with that.
Yeah, that's great. I'm wondering if you can talk a little bit about when during the course of treatment or recovery do you see infection most often? When do these precautions need to be, I mean, they're very important to follow all the time, but like when are they most important to follow? And is there a point where someone with AML is not necessarily immunocompromised anymore? When can they kind of start expanding their horizons, and when do things get less like living in a bubble for someone?
Of course, that's a great question. So I don't know if this is going to show up backwards, but usually when we are giving chemotherapy, when we actually first start to administer chemotherapy, we don't see a huge change in the patient's blood counts. And it is about 2 weeks after we start chemotherapy that the blood counts drop and get very, very low. And that's when they're at a very high risk for infection. We expect that the blood counts will start to recover and the immune system will improve after about 3 to 4 weeks of like after the treatment. So we have this roller coaster effect. It's hard to predict what's going to happen, especially for that first cycle of the induction chemotherapy. And with that, I think most patients are in the hospital, but usually it's normally the safe zone is right before the patient is to start their next cycle of chemotherapy for either consolidation therapy or maintenance therapy. So about 30 days after they receive chemotherapy or the first day of chemo. And when they're at the highest risk of infection, it's when the blood counts are very, very low, which is usually around 2 weeks after starting treatment. So that's usually when we see the bulk of infections. However, every patient, every body responds to chemo differently. So that 2 week area might be 3 or 4 weeks for someone else. It really depends. That helps.
Great.
Answer.
Yeah, no,
So
that was good. I like the picture.
Yeah, the safest time is usually I tell patients right before you're due to see me to start your next cycle of chemo, but we can always check blood counts if you want to do something, see how you're doing to, if you want to be with friends and family and have a group dinner or something. What's the safest time for me to do that?
Yeah. I'm also curious if there are certain AML medications that cause you to be more immunocompromised than others, or do you see that at all? Are there specific meds that make it worse?
They all act very similarly. Those with hypomethylating agents that we're receiving for a few days in a row, maybe in combination with venetoclax, they can become very immunosuppressed. That goes along with the intense chemotherapy, 7+3, high dose cytarabine. So most of the medications and chemo that we do give our patients, they're all the same when it comes to immunosuppression. Just those who would be that even at higher risk is the patients who have received a stem cell transplant and are on immunosuppressants. There are some maintenance therapies that may be on a clinical trial that don't cause the blood counts to drop as much. And as we see the blood counts actually stabilize and the neutrophils staying above 1, then the immune system is pretty good and they're at lower risk for infection, which is great.
Awesome. In the chat, just a few comments that I'll read. Juliet said, I found liquid antiseptic is helpful for getting into cracks and crevices, such as fingernails. And then a direct message to me, so not everybody saw it, but I will read it because I think it's useful, saying don't drink out of a soft drink can without a straw. Grocery warehouses and grocery stores, as well as the can manufacturers and trucking companies, are just germ pools for cans. So yeah, another tip there.
That is a great one. And yeah, it's also be careful with cans because you can easily cut yourself. I've done it so many times. So
yeah, that's what I thought they were getting at when I first read it. But yeah
but no,
twofold.
Remember anything that's exposed, right? Or wipe off even the can. I think I forget about that. It's my own personal habit to wipe off a can anytime I'm going to pop it open. So it's a great one. Thank you for sharing.
I'm wondering if we can talk a little bit about COVID and what you're seeing at your facility currently. How are patients faring, AML patients faring with COVID infection? What do we know about COVID vaccination and how AML patients, how effective is it for AML patients, things like that?
COVID infections, I think we have been fortunate. We've been still seeing COVID infections, but I think the symptoms have been less severe. And we have been basically admitting the patients for evaluation to get IV medications like antivirals or even antibiotics to help prevent infections that can even occur because of the exposure to COVID-19 or like concurrent infections. I will say I'm definitely seeing less severe cases, but I will preface that I mainly work outpatient, so I have not seen the the bulk of those admissions of those who have been admitted for COVID. But I will say most of the patients that we have outpatient are fortunately doing well. I'm not advising people to go get exposed, but I think the infection hopefully is getting less severe and we are able to detect it quickly. So I think those two who have gotten the vaccines, it has helped. We were doing antibody testing for a little while for the COVID vaccine to see if there were antibodies found in the blood that has a memory to fight off the infection, because those vaccines are really helping our white cells to remember their exposure to that to be able to fight it off so patients don't get as sick. So right now we're just really recommending our patients to follow those FDA guidelines for vaccinations. I know that's been changing a lot, but we've been supporting that. What was the other
Yeah.
part of that question?
I think you covered it. I was just mostly
Okay.
curious about what's currently going on in vaccines. So that was helpful.
Mm-hmm. Good.
You mentioned mask wearing being very important a few times, and I was wondering if you could clarify type of mask. Or are cloth masks okay? Surgical masks? Do we need N95s? Like what's the recommendation?
Here we are still doing surgical masks and providers, any patient contact. Basically, if you walk around the hospital here, everyone has a mask on. So I think any medical grade mask is excellent, especially if you're in a healthcare facility, a doctor's office, probably even like going to the grocery store, pharmacy, things where you're going to likely run into those people who may be sick, because I think they have the best protection. If you feel more comfortable wearing the N95, I would say go for it, or the KN95s, because they are supposed to have a little better protection. But I think, if you're around like friends and family, if no one is sick and you would like to wear a cloth mask because it's more comfortable, that's at least some form of a barrier. And then, I tell patients if they're out at a park and they're not in closed settings, it's okay to not wear a mask, have fresh air. I do have, the other thing is here in Houston, we have horrible allergies. So the masks actually help with a lot of that kind of upper respiratory like infection or exposure to allergies. So it may actually benefit them to wear masks to help protect some of those pollen exposures. But yeah, I think any mask is better than nothing, especially when they are in high risk for an exposed area, especially like traveling, air travel, anything like that.
Yeah, great. Lisa's asking if there's ever a time during treatment that it's safe to attend a family gathering, or would you recommend avoiding that type of situation altogether until treatment is over?
So I think there can be safe times to have gatherings depending on blood counts, where you are in treatment. I would recommend having that conversation with your provider because, we do want you to do things and see your family and friends because I think it's important for so many reasons. Of course, and we want to help you do it in the safest of possible ways. So I think there are a lot of times where you could make that work, but you might need some planning accordingly.
Great. I think that kind of leads into a bit of a discussion we can have before we wrap up, unless I see another question come up. But we've talked a lot today about what you shouldn't do, what you can't do, what you're limited on, the fear of infection. I think a lot of those are really hard things, on top of, going through treatment and being a patient of AML. And so I'm wondering if you have any tips for people about, one, kind of just managing the fear and anxiety of going out. I think that's a really tough thing. Fear of infection, but also managing the isolation and the loneliness and feeling so restricted. Are there any helpful things you share with your patients about all of that?
A hard one. I think having family, friends, and support is really important. I think it's really important to have some normalcy in your life. So for instance, my patients who work, if they have the ability to work remotely, I really encourage that because sometimes it's nice to even have an interaction through the computer with people to plan to see a family or friend out in public. It doesn't need to be at the most popular restaurant. You guys can go meet at a park now that the weather is getting better, or go on a walk. But I'm a little, talk to your family and friends, make sure that they are not sick so you reduce your risk. And I think it's fine to see family and friends, wear a mask, use hand sanitizer. I do not like making my patients isolate because I think it's really challenging, and I think you need that support group. So I would say do things in small doses, and talk to your provider and explain to them what's really important to you. What do you need to have that support to get through chemotherapy? And in some cases, our patients with AML are living with this and receiving treatment continuously. So how can I safely do the things that I enjoy to do, and have a kind of like as normal lifestyle as you can? So, recommending going to the grocery store at, not 5 o'clock on a Sunday, go in the middle of the day if you can, go at less popular times. So you're still around people, you're still in public, but you just are not, like on the New York subway station or something where you're crammed tight, in close quarters. I had a patient the other day who just loves gardening and had given up gardening because of the risk of any type of infection. So, she's come up with her own ways, and she now just enjoys telling her son where to put things. She picks out the plants and he plants them. So she's happy with that. But in those situations, I had a patient once who just loved to garden and did it on their own. And I said, okay, just make sure your arms are covered, try to prevent some type of infection. And they did it, and I supported her through that. So a lot of it goes to, don't be uncomfortable or scared having these conversations with your provider. Just to explain to them that, it's your life, you still want to do things that you enjoy, you understand. Chemotherapy is very, very important, but I think to get through it, you need some things that are like normal life.
That's really great. I love those examples. It sounds like having open conversations with your loved ones and your medical team to help you come up with a plan, so that way you can still engage in the things you enjoy in a safe way. It might require a bit of environmental modification, or having someone else kind of lead and you kind of direct. But those are really excellent tips on how to keep up quality of life, which is something we all really, really want to maintain. Yeah. Awesome. Well, we're right at the hour, so I think we'll wrap up here. Thank you so much, Sami, for being here with us today. This was really, really great. I'll end by thanking our HealthTree Community for AML sponsors once again, who are Servier and Astellas Pharma, and thank each of you for being here, for helping us build a strong HealthTree community for AML. I really appreciate you all. I hope you have a great rest of your day, and really hope to see you again soon.
Thank you all.